In this chapter, we will discuss retainers for removable partial dentures, where this topic is more in the removable prostheses, but using the abutments as retainers. We do a complete preparation and a complete crown or bridge restoration. So it is a combination between fixed and removable prostheses. There is two philosophies between fabricating the restoration with a full coverage of the teeth, that will be a retainer, or to do some simple adjustment on the normal occlusal surface of the enamel. Although this is the last approach is more conservative, however, using the cast restoration on abutment teeth enable precise shaping of the axial contours, which will make the masticatory and retentive forces be directed more favorably through the appropriate use of occlusal rest seats and precisely shaped guide planes, which also can offer significant aesthetic advantages over the clasp retained denture. So we see in this case that we used fixed complete abutments with the appropriate concavity for the attachment of the retainer of the partial denture. The occlusal rests are created on the mesial of the posterior crown. The anterior crowns incorporate the cingulum rest. Here we see the incisal rest on the mandibular canine, and this is for the premolar, where we have a minor connector that is attached to the. This is the rest on the occlusal surface of prepared teeth. Another way is to use the cingulum of your teeth to do a V-shaped rest seat, where we have a pin retained casting on it, and it is resin bonded. The metal alloy can be from titanium or gold alloy, or platinum, gold, palladium, or nickel chromium. When preparing the rest seat on the occlusal surface, its thickness must be 1 millimeter in the area of the occlusion. As for the axial contour, we do axial reduction to decrease the bulkiness of the device and to allow the non-retentive part of an occlusally approaching clasp to be positioned as far gingivally as possible. 2 millimeter of avoiding the gingiva is optimum. In this case, we can see the combination between fixed prosthesis and the removable one. In the maxilla, we did a complete coverage of all the teeth with a fixed bridge. This we made a preparation for the rest or the clasp. As for the mandible, we did a bridge only of 3 units with also prepared occlusal seats. And here we added what is called a gold dome that will provide support for the removable prosthesis. And this is the final maxilla and mandible with the partial removal prosthesis in place. We must do the rest seat preparation when we do the full crown preparation. After that, we do the waxing, then the casting. We must make sure that the rest seat should be at least 1 millimeter from the metal ceramic junction to avoid excessive occlusal load. So we have two options. The laboratory can do the preparation of the occlusal rest in the waxing stage. Then we do the modification on the tooth when we are going to cement, or we do the preparation from the beginning. Now let's talk a bit about the attachments. They are two components. One is incorporated in the crown and the other part is in the acryl of the denture. In general, the use of them should be limited because they increase the complexity and the cost of the restorative service. In one study, only 22 out of 57 prostheses were free of complications during the first 2 years. These are one of the shapes of the attachments. One part is attached to the teeth or the bridge, and the other is incorporated inside the acryl of the denture. And these are the tools for the application or the doing the attachment between the two pieces. 5 is called the positioning mandrel, and 6 is the adjustment tool for any further adjustments in the future or to replacement. Here you see the laboratory steps where it is attached in the waxing procedure. Then it is casted, and the other part is inside the casting of the denture. We see that it is not seen because it is covered by the teeth and acrylic, and this is the occlusal view. It ensures that we can get a sufficient cleaning in this area. So it has two shapes, an angled one and a straight one that can both do the job. Another shape is called the Dawson 2.7 attachment. This is it. The matrix is made of a housing with a spring-loaded plunger for retention, and this spring and the plunger can be changed or removed for the replacement in the future. And this is the occlusal view of the attachment between the fixed bridge and the partial denture. This is plastic performed patterns for an intracoronal rest. So these tools are used for the fabrication of the attachment intracoronal rest. They are emphasizing about the leaving 1 millimeter between the preparation and the attach and the connection between the metal ceramic junction. And these are the different shapes and types for the attachments. Another use is in the complete dentures, where we can get benefit of the residual roots inside the mouth. We do a root canal treatment, and we do an occlusal preparation of the remaining structure of the teeth. Then we must be sure that we have enough vertical space for this type of connection. Then we add the first part, and its coping is inserted in the acrylic full denture. To ensure a precise connection, we place the connector over the coping, and then we add acrylic on their place. Then we do a denture insertion, and this is after the removable of the excess resin around the component, which are now mechanically retained in the processes. So this is the way of application. This is the concept of the bar retained. This is a case where it was used between two crowns. Then they were casted over them with metal and acrylic. So the author prefers the full crown coverage of the retainers for a fixed denture, and although we need amount of reduction that is more than the normal fixed bridge, but it is necessary to allow the place for the occlusal rest seats and have a good axial contours with appropriate guide planes to get the optimum aesthetic and functional results. That's it. Salam.